questions. I hope I can remember. We don't have for me to write.
So so you just hold to switch it off, and then hold.
Okay.
Hold to switch on, switch off. Mic check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Which camera am I looking into? That one. Okay. Okay. Yeah. Okay. All right. Good evening, ladies and gentlemen. My name is Bonginkosi Mafuze. I am your host for the launch of Doctors of Mind Mental Health podcast, which is brought to you by Official Publishers. And I have some beautiful guests that are here with me on stage this lovely evening, and I have the pleasure of introducing each of them. So the launch of Doctors of Mind has to do with us debunking the complexities of mental health, making mental health education accessible to all those out there, and not just be something that is only that you get told about when you reach a mental health facility or health education program. So today, part of my panelists that I have in the launch of our podcast, I've got 4 people, excluding myself, and you'll see why. First up, I'd like to introduce the one and only, Dr. Judy Dlamini. Unfortunately, I have to read her profile. She is such an amazing woman, and she's done wonders, and she's one of the main sponsors for our program. Dr. Judy Dlamini is the founder and executive chairman of the Mbegani Group, which has been in business for over 27 years. The group has operations and investments in different sectors, which include health, facilities, property management, private equity, and venture capital through a multi-family office. She's also the founder and CEO of Official Publishers, which is the main sponsor for today's podcast, and also Equal But Different. She's also the former chairman of Aspen Pharmacare, which is a JSE-listed company. She's an alumni of the University of KwaZulu-Natal. She had her degree in Bachelor of Medicine and Bachelor of Surgery, class of 1985. She has also done a diploma in occupational health from the University of Free State. She's got an MBA from Wits University. Dr. Judy Dlamini is also a recipient of a doctorate in business leadership from the University of South Africa. And she is also titled and author of a bestseller book called Equal But Different, which is a conversion of her doctoral thesis. And her philanthropic work includes the vehicle called Female Academic Leaders Fellowship, which is a non-profit company, and Kiwa Trust. She is the recipient of numerous awards, which include honorary PhDs in economics from the Nelson R. Mandela University, and also an honorary PhD in business from the University of KwaZulu-Natal. Welcome, Dr. Judy Dlamini. And on my left, we've got Professor Suvira Ramlal. She is the clinical head of the specialized psychiatry at the King Dinizulu Hospital Complex in Durban, and an associate professor in the Department of Psychiatry at the University of KwaZulu-Natal. She also graduated at the University of KwaZulu-Natal, and she is a lecturer and is also the first academic leader of the Registrar Training Program. And during this time, she was also a member of the Registrar Steering Committee. She serves on the KwaZulu-Natal Provincial Technical Advisory Committee for Mental Health, and as the current president of the College of Psychiatrists of Medicine of South Africa. She co-founded the KZN Mental Advocacy Group, which, among other community activities, hosts an annual multidisciplinary mental health symposium to commemorate Mental Illness Awareness Month, which is where we are currently, and the annual Mental Health Walk to commemorate World Mental Health Day in October. She has published in local and international journals, co-edited a South African textbook on talk therapy, and her latest book on building mental and emotional resilience is due for release later this month. So there's a lot in store for you during this Mental Health Awareness Month. And then right in the middle, we've got, welcome Prof. Ramlal. We've got Mr. Melizwe Kumete. Sabelo Melizwe Kumete is a qualified industrial psychologist, still very young. He's a founder of Cloud Therapist and Upembe Consulting Group. He holds a master's at the University of KwaZulu-Natal and is currently a PhD candidate in the University of South Africa. He is a partner at Varsity Connect and deputy chair at the Goodman Foundation. He has special interests in mental health, medical legal, leadership, and also research. Welcome, Mr. Kumete. And last but not least, we have Ms. Bhavna Deviprasad, who's right here with us virtually, the use of technology. So Bhavna is the director at Bhavna Deviprasad Occupational Therapist Incorporated. She is a qualified occupational therapist from the then University of Durban-Westville, which is currently known as UKZN. She has a certification in the Workwell Functional Capacity Evaluation. She's also got a certification in the Psychiatric Functional Capacity Evaluation. She comes in with the vast many years of experience. She's got 16 years of experience in providing rehabilitative services in a lot of the areas, working both in public and in private healthcare. She has done work in forensic and acute psychiatry, community-based psychosocial rehabilitation programs. She delivers psychosocial rehab for those with substance abuse and works with some NGOs around Durban. She's also involved in acute and long-term adult and child musculoskeletal illnesses, neurological, autoimmune, and many others in the medical dictionaries. She's also involved in the development of vocational skills training and working in hardening programs. She also provides information on economic adaptations which are necessary to improve accessibility for individuals with disability. She's also involved with medical, legal, and functional capacity evaluations. She's also involved in disability claims as an assessor for insurance industries and various other companies. Welcome, Bhavna. Okay, with all of those introductions, I think it's good to say that we may have a long evening, but I'll try and make it as short as possible. So just to kickstart the conversation this evening, I'll start off with Dr. Judy Dlamini, perhaps to give us more information on what is Doctors of Minds and why are we here?
Thanks very much. Thanks for that question, Mafuze. Before I answer it, I just want to thank everyone who's here. I see Prof is here. We really don't take it for granted that you are here physically. And thanks to the panelists. You would have noticed that everyone that was introduced on the panel has some linkages to mental health, except yours truly. So then the question is, why Sifiso Publishers and why you? It's interesting. I was just saying to somebody earlier on that there is a way where you find yourself where you're supposed to be, and it doesn't make sense sometimes till the universe connives and you are where you should be. So why Doctors of Mind? I think Dr. Mafuze has explained that, what we're trying to achieve, mental health awareness, making help accessible, amongst other things. But why did I get involved? You know, Dr. Mafuze and I had an alignment of minds when we thought, let's start this to offer help to communities. And for me, there was a trigger, and that trigger was having the privilege to co-author a collection of reflections on an African giant who is also a UKZN alumnus. We celebrated his life with a colleague and all the people that contributed to this biography. It was 78 of them from all over the world, not just in Africa, not just in South Africa, from the West as well. His life was so full and he changed so many people's lives. He lifted as he rose, but there was an elephant in the room because his life was ended by suicide, you know? So as we, as Fiso Publishers, we sponsored the book, and we will be donating the proceeds to Bongani Mayosi Foundation to make sure that his legacy lives on. It's not a lot of money because books are not money spinners, but just the idea that we can actually put something together that will make a difference. So there was a part of me as a doctor, as a leader, as a mother, that said, you can't inspire, especially young people, about this giant, a life, 51 years of excellent life, and not talk about how his life ended by informing people and making them aware of mental health issues, and also how to take care of yourself. Some call it positive psychology. So then I just felt like something was not done, and this is it. And thanks to Dr. Mafuze, because it was easier to talk to Dr. Mafuze that I've known for almost a decade now, because he is in the space and I'm not. So I needed to have someone who has shared ideas, and he was already there. It was just me saying, oh, okay, let's take this bus and this journey together. And I'm happy that we did. And I did some reading up on mental health in preparation for this, but I'll spare you the statistics because I think you already know, because most of you are in the field already. Thank you.
Thank you very much, Dr. Dlamini. You know, they say great minds think alike, but also do small minds. So just looking at the acronym of Doctors of Minds, which is DOM, which is DOM, when we think of mental health, people think that it's something dumb, you know. You start thinking there's negative connotation towards it. We're not really sure what it means when we say take care of your mental health. So I'd just like to ask Professor Ramlal just to unpack for us, how do we define mental health, and who does mental health affect?
Thank you, Dr. Mafuze. I would just like to first take this opportunity of congratulating Dr. Dlamini on this initiative. Those of you who know me, I'm a psychiatrist, but my interest is more in mental health and well-being rather than the treatment of mental illnesses. So this is really close to my heart. And also to congratulate the young Dr. Mafuze. I've been in the business, mental health business, for a long time. And it's really heartening and inspiring when young doctors as him, he's currently a registrar in the hospital where I work, take up such societal issues and advocate for mental health. And it's not easy being a registrar. For him to take this on additionally is really something that I feel proud of. And I know that many people will benefit from that. So congratulations and well done. So yes, it is unfortunate that the word mental has such negative connotations. You know, we equate it with craziness and dom, all right? And I'm very sensitive to that, you know, the misuse of such words like crazy, etc. So, you know, it's a very difficult concept to define. And even if you look at the World Health Organization definition of mental health, you'll read it and you still won't have an understanding of what mental health constitutes. So let me use the analogy. A lot of us know about our physical well-being and physical health. We know how to look after this body. We know how to nourish it, to cleanse it, and to exercise it, to rest it, etc. And we know that we can get certain diseases or disorders, or we suffer pain if we don't take care of this vehicle, all right? So where does the mental part come in? So let's use the analogy of a computer, all right? For a computer to work efficiently, it needs hardware and it needs software. The hardware is the body, all right, the physical apparatus, which is important, all right? But you know that that empty shell is useless to you, no matter what brand you are using, without the inside, the software, the battery, all right? So I like to think of mental health as that inner apparatus, all right? What happens in your mind, your thoughts, what happens in your heart, your feelings, your emotions, what defines you as an individual, your values, and also what defines you at a spiritual level, all right? Are we just human beings, or is there more to us? And most people do subscribe to some higher meaning in our lives. So all of those domains all happen silently within us, but we underestimate the power it has, because what's happening on the inside influences what happens on the outside, influences our activities, our decisions, our behavior, our success ultimately, all right? And yet we pay so little attention to what happens on the inside. And when we talk about the inside, what happens at the brain level, what happens at the heart level, what happens at the spirit level. So for me, that's what constitutes mental health. It's about the health, the state of wellness, the strength, and the resilience of that software that we have inside us that makes such an important role, plays such an important role in our overall health, because health is not just physical well-being, it's about our mental health, physical health, spiritual health, social health, societal health. And that's what makes us uniquely human. So for me, it's about a holistic approach. And we really also, although we speak of mental health, you can't enjoy mental health if the body is not well. All right, so when I speak mental health, I think it's important for us not to compartmentalize and dichotomize mind and body. For a long time, even doctors did that. Focus, it's either the mind or the body, and if you're working on the side of the mind, we are also kind of, look at the crazy ones, you know, those doctors who deal with some kind of mambo jumbo. So a lot of stigmatization, but a lot due to ignorance. And as we advance in terms of mental in science, we are seeing the interrelationship between mind and body proven scientifically. All right? And unfortunately, a lot of people need the evidence in a scientific journal before they will accept eternal wisdom. Mind and body go together. If you don't have good mental health, it affects your physical health. And we all know, even if you stub your toe, no matter how mild it is, or if you have cancer, it affects you mentally. It affects your thinking, it affects your emotions. So it can be a vicious cycle where they both worsen each other, but if we educate ourselves about mental health and well-being, it can be a virtuous cycle where our physical health and our mental health work in harmony for our overall health. So it's a long answer, but I think it's important at the outset, if we are going to make any progress, to have a clear understanding what we're talking about when we talk about mental health.
Right. Thank you so much, Prof. Ramla. I mean, you are a psychiatrist. Mr. Gumede is a psychologist. So we usually ask ourselves, like Mr. Gumede will help us to unpack, what is the difference between a psychologist and a psychiatrist? Because when you talk mental health, usually those are the first individuals that come into mind. Yes. Am I going to say a psychologist, a psychiatrist? Could you just unpack for us?
No, thank you so much, Mafuze. I really appreciate this opportunity, and I feel privileged to be seated, in the midst of these intellectuals. And congratulations to you for launching this platform. I think it's a great platform, and I'm happy that it's digital, which means that it's going to reach quite a number of people. Yeah, well, back to your question. Psychology is a study of mind and behavior. Also, it has, of course, different specialization. We have industrial psychology, which I am. There's clinical psychologists, there's counseling psychologists, and there's also research psychologist. But then the understanding of it vis-a-vis psychiatrist, we see we treat patient using the psychotherapy methods or methodologies, where we don't actually administer any medical treatment. But then the clinical psychologist, then of course with the application of the DSM-5, then classify what can be termed as disorders that a person might be struggling with at that particular point in time, and then ultimately then refers that person to a psychiatrist. Then the psychiatrist, of course, then actually provide a script in terms of medication on what that particular person, is supposed to actually take to deal with whatever mental health difficulty that the person is actually struggling with at that particular point in time. But I would also like to touch to the positive side of psychology, which is a new kind of paradigm that has been it's been mushrooming around, I'll say 1998 with Professor Seligman, where quite a number of quite a light, was shed around what Prof next to me was talking about around the positive side of life, where we talk of resilience, we talk of hope, we talk of strength, because for one really to understand mental health, we need not only to focus on the mainstream negative side of things. There is what we can also cherish. So positive psychology actually advocates for that, where we actually focus on positive well-being, the positive side of life, the flourish, on the quantum of mental health existence, what we call excellence and driving, where a person can actually reach a state where they are able to actually, fulfill their goals, achieve, and be a good team player and have good interpersonal skills. So I'd like for us also to actually focus on that kind of paradigm in our understanding of mental health.
Okay, thank you. I think maybe we will realize as much as it may be difficult to spell psychiatrist or psychologist, even the complexity of the answers that to the questions that I give, you can see there's a lot of substance in these. So it's a field that still needs to be debunked and made so much more easier and to be reached by persons even with the lowest level of education, persons in the furthest of environments, persons who aren't able to be with us like right now, sitting here or live streaming from home. So there's a lot that we still need to do in terms of mental health. So Mr. Gumente, you touched on DSM-5. So DSM-5 is the Diagnostic Statistic Manual 5. So that is like a dictionary of mental health. So when you read the DSM-5, most of these disorders or mental health illnesses, they talk about mental health affecting your functioning. So your social functioning, your occupational functioning. So my next question goes to you, Bhavna, who's joining us virtually. So Bhavna is an occupational therapist. Perhaps if you could just unpack for us, what does an OT do and how are they involved in mental health issues?
Thank you, Dr. Mafuse. Once again, congratulations on achieving such a milestone. And thank you very much for including not just me on this panel, but creating a little space for an occupational therapist. I think very often we tend to forget the role of an occupational therapist within that mental health care team. So I'm grateful for that, and thank you for having me on. So basically, listening to what everybody has had to say today, very often an occupational therapist will receive questions from patients or colleagues or mental health care users to sort of understand what is an occupational therapist firstly, and how is an occupational therapist, again, different from their psychiatrist or psychologist or social worker. And the impression is that there's a lot of overlap or repetition. So just to basically explain what an occupational therapist is, I'd just like to highlight that an occupational therapist is a trained mental health care provider. And the occupational therapist will often work as part of a multidisciplinary team. And that therapist usually works together with that team to achieve a common goal for a mental health care user. So while each of the team members are working towards achieving a common goal, for example, to rehabilitate an individual with a major depression, to facilitate, say, successful return to their workplace, how an occupational therapist would do it is what sets occupational therapy apart from the other disciplines. So, for example, an occupational therapist's main role or focus would be to achieve optimal levels of functional independence. The OT's role is to help an individual achieve and fulfill their roles that are unique to their lives. For example, as a partner, as a scholar, as an income provider, as a member of their community. And the main difference, or what is most essential or unique for an occupational therapist, is our medium of treatment. So whereas our colleagues would use medication or psychotropic treatment or psychotherapy and counseling, an occupational therapist will often use a meaningful activity as part of their medium of treatment. I've been practicing long enough, and it's important for me in my profession to understand the perceptions and misconceptions out there. So when we say meaningful activity, it means not just occupying an individual or taking out a board game and having a recreational activity. I think every activity that an occupational therapist uses very much thought out and planned, such that that therapist can elicit a certain response, be it cognitive stimulation to improve someone's attention and concentration span, to improve their self-esteem. So I think there's a lot of activity analysis that goes behind what an occupational therapist does. The occupational therapist, the role is a little bit complex in that treatment is not standardized. It's not a one size fits all. An occupational therapist will usually work with an individual holistically and look at the different parts of that individual, be it mind, body, soul, spirituality, and look at and see where the deficits are lying. And that therapist will tailor make a specific treatment program that is very unique to that individual to help that person return to their best way of life, to return to their daily functioning so that they can perform their meaningful activities in their lives. So I'm quite passionate about being an occupational therapist. My job is very colorful. It's very different. And after all of these years, there are no two patients alike. So in every day of practice, as much as I impart some knowledge or skill that I've learned, every day for me as a clinician is also a learning experience. And then I think, the occupational therapist role then sort of evolves from rehabilitation in an acute phase to a medium term and a long term phase of rehab, and then we evolve to the medical legal assessments and the functional capacity evaluation assessments, which ultimately helps an individual in such a way that they're able to reintegrate into the open labor market, either through ergonomic adaptations or reasonable accommodations provided by the employer. But I would just like to stress to those of us that are watching in and listening today, the occupational therapist has a role from acute onset of illness all the way, up until the point when individuals preparing to reintegrate into their community, their home, and their work environment. It's sad when I see a mental health care user who's just only referred at the end stage, and it's purely for the purpose of a medical insurance claim, or it's for purely for work purposes. So it's nice to see, or as a clinician, we'd like to be a part of that process where individuals are rehabilitated in such a way from an early onset of illness or early diagnosis to actually achieve their optimal level of functioning before we can consider reasonable accommodations and work adaptations. So I think in terms of my field, there's a lot that's out there to offer, but again, it requires a good understanding and working with a proper and a good team who's able to recognize, understand where each of the role players fit in. And yes, so we're very popular for functional capacity evaluations and medical legal assessments. And again, it's very lucrative, so I'm not complaining. But the real reward, if you're really passionate about mental health care, the real reward is in seeing a client as early on as possible and assisting them and facilitating this process of rehabilitation and watching that person evolve and achieve their best life. So, that's where, in a nutshell, very simplistically put, that's basically what an occupational therapist is in the mental health care team, and that's essentially the role that we have to play. Thank you.
Yeah, thank you very much, Bhavna. I think if I were to ask the question, how would one define the anatomy of the mind? It's very complex. It's very easy to get the anatomy of the body, which veins go where, which bone sits where. But when it comes to the mind, it tends to be very technical, very complex. And I think from the answers that you guys are giving me, I can already tell that it's not an easy space to navigate. And it seems like you need to understand all individuals. You need to understand people's backgrounds. You need to understand how they function, what they do, meaning you need to be an open person. You need to be able to engage with persons. So mental health seems to be quite a complex thing, but this is what people live with out there. So maybe these are some of the challenges or things that we need to make more simple for people to know that if I have this particular problem, then this is the type of assistance that I can seek. So, Professor Ramlal, what are some of the common mental health symptoms that someone can experience for me to say, okay, maybe I potentially have a mental health illness? So what symptoms can one experience for them to think of a mental health illness?
So that's a trap question, and I'm not going to answer that. I'm going to go through a long about way, because I think it can be very misleading for the general public when you start giving them a list of symptoms. Then we become Google doctor, and that can be very dangerous. And especially if you remember my definition of mental health, we said it refers to what happens on the inside, but what manifests on the outside. So what you are thinking, what you are feeling, what are your beliefs, your values, and then how that influences your behavior in different situations, and also how it affects your body. Because remember I said mind and body are interconnected. So can you see that the symptoms, when something goes wrong, any one or more of those domains get affected? So it can affect your thinking, it can affect your feelings, emotions, it can affect your physical health, and affect your behavior. So maybe a good thing, maybe not a good thing, but I'm not going to give you a list of symptoms that you're going to look out for, because if I gave you a list of symptoms, every one of us has had some or other at some time, well, most of them, because they are very normal day-to-day thoughts, feelings, behaviors that we all experience. So what I advise is, if you are concerned about your state of mental health, and remember when we're talking about, there's mental health where you are healthy on one end of the spectrum, and then we all have challenges in our lives. You go to mental distress, all right? So you're not ill, but you're not completely on stable ground at that time. You are a little bit on shaky ground. You're distressed, you're unsettled. And then on the other end of the spectrum is mental illness, where you now have a diagnosable medical disorder, and that's what psychiatrists do, because we are medical doctors, and we diagnose a medical condition. So depending on what stage you are in, you're going to experience or manifest mental symptoms differently. So the approach I advise is to look for change. Bhavna has very eloquently described how we focus on an individual, because each one of us is unique. We all have a history that dates back not just from when we were born, but we have an ancestral history that's in our genes, it's in our culture, it's in the habits and the lifestyles, which we inherit, gets passed down from generation to generation. A lot of them are good, some of them not so good, because we carry baggage as well. So where does somebody's history begin? All right, and it's particularly relevant when we look at the context of South Africa and apartheid, or we say, okay, we had democracy now, it's more than 20 years, we should have moved on. But there are certain patterns that are entrenched, that have become part of our mental programming, which is very hard to reverse. It doesn't take one generation to just upgrade, as we upgrade our cell phones and update our software. So coming back to how you identify when you should be worrying that you are in distress or you have illness, first define the baseline for yourself. You know your history, you know the experiences you've had in life, the challenges you've had, the strengths, the supports you have, and you know you. You know what your thinking patterns are like, where your mood is in general, and happiness is not a straight line or normal flat line. We're constantly changing with the environment, all right? That's normal, all right? So if you're looking for that straight line of eternal happiness, you need to come see me. So first identify what your baseline is in terms of also your behaviors, all right? So you know that you're a person, for example, that takes a shower 2 times a day, and that's your norm. There are other people who take a shower once a day, and some people who take a shower once a week. If that's their norm, it's working for them and it's working for everybody else, that's fine, okay? Normality is also not a narrow, compartmentalized definition, all right? You have to look at the context, what's normal for that individual. So once you've defined normal, then look for change. All right, look at where you are on the spectrum. Am I healthy? Am I getting distressed? Am I worried that I'm mentally ill? And then look at those changes. And the changes will happen in your thinking pattern, in how you feel, how you behave towards other people or towards yourself, how you are functioning within society in terms of interpersonal relationships, academically if you're a student, or occupationally. Those are the main domains of functioning. So it's a very sensitive indicator. If you're not functioning on the outside, usually means that something on the inside is not working in your best interests, all right? So I think that's an easy way, because everything, every symptom, it's about your thinking, about what you see, what you hear, your values, your emotions, the things that you do or you don't do. All of those could be potentially symptoms. Do you see? Because it depends on what your baseline is. There are obviously certain things that are concerning, that we'd be more concerned about, for like your sleep. I mean, we have good nights and bad nights, but there are certain specific changes that we would be very concerned of, that would be diagnostic almost of a disorder. But once again, there's a gray zone, so I'm not going to say. So if I give you an example, grief. Grief is a normal human emotion. We all will experience loss of some kind throughout our lives, all right? And it's a normal process of our emotional and mental growth to process that grief and to grow and move on. But you'll notice in the DSM-5 now we have complicated, prolonged grief that's come in, all right? So we have to have a responsive diagnostic system as well, because the world is changing, people are changing. The current generation is very different from my generation in terms of how you experience the world, how you experience stresses, and what is defined as normal and abnormal. When I joined psychiatry several decades ago, homosexuality was defined as a mental disorder. Right? And I don't need to tell you how far we have come now in terms of opening up our minds, opening up our hearts, and being more inclusive and accepting of people that are different from what we construe as being normal. All right. So coming back to your question, I didn't forget, I know psychiatrists can be very circumstantial, but you know, if you are concerned about changes that are enduring, they're persisting, they're causing some discord in your life, whatever it is, it could be a minor thing about your eating, or how much you eat or don't eat, or what you're eating or what you're not eating. These could be early signs. So if it's persistent, if it's a transient thing, we all go through food fads and changes, etc., it's fine. But if it's persisting, and you feel that it's now starting to impact on your functioning, socially, occupationally, academically, have a chat with somebody, all right? Your first point of call, go to your GP, and they can check out. Because also to remember that sometimes these symptoms can be the first symptoms of an underlying medical condition affecting your body. All right, so once again, I'm emphasizing there that we say mental illness, we're afraid because of the stigma, or how can I go and tell somebody I think I'm kind of losing my mind? No, all it could mean is that you're deficient in something, and that if they just replaced your thyroid hormone, you wouldn't feel so depressed or lethargic and gain weight and overeat, etc., etc. So I hope that answers your question, as I'm specifically not giving you a list of symptoms, because I think that can be very misleading and also can be harmful sometimes, where people start to say, oh, I have that, so I have to be going crazy, or I'm being mentally ill. Does that help?
Yeah, thank you very much for giving that answer. It was a trap on purpose, just so that we can highlight, because next thing I'm feeling tired, I've had a long day, I was at work, I'm having loss of energy, I don't even feel like eating. Next thing I'm thinking, okay, maybe I'm meeting the criteria, and for some reason I'm sad today because my boss shouted at me, and then I'm like, what if maybe I have depression, you know? Then I start worrying and getting anxious and thinking, no, maybe this and this is happening to me. So I think the take-home message would be, if you can see that the software, there's something wrong with the software, then there certainly needs to get it checked out. You drop your phone in water, it stops working, you're not sure where the problem is, you go to the technician who fixes your phone. even your computer, when something physically there's no damage, certainly there must be something inside that's an issue. So you take it to a computer technician. So it's those type of things, and I think you highlighted it and captured it very well, Prof. Bhavna spoke about part of an MDT, which is a multidisciplinary team. So in mental health, we have various mental health care practitioners. So we have psychiatrists, psychologists, occupational therapists, social workers, nurses, students, physiotherapists. Like the team is quite large. So Dr. Judy Dlamini, you explicitly said it out earlier that, okay, I'm not a mental health care practitioner. So you've been involved in business and in leadership for many years. So how would you think businesses or industries can be involved in the mental health care space?
Thanks very much for that question, Mafuze. It's a two-pronged approach when it comes to business, because business is part of a society. But starting with business itself, I was listening earlier this morning to one organization. I'm trying to remember the name they called it, where the employee checks out, you know. They are seeing a lot of that post-COVID. Say that again?
Quiet quitting.
Yes. Welcome, Jabul. Yes, you know, and they were saying people disengage, and what they've started, I won't call them by name because they haven't donated to this good cause yet, but they were talking about an initiative they've started as an organization where on Wednesdays it's half day. And that half day is to enable the employees to replenish, to take care of themselves. And I just listened and I thought, I hope mothers don't take that time to go and sort out their families, because that's what we do. But what's important when it comes to business itself is the hygiene factors within the business, one. And by that I mean, just make sure that the environment is positive. The environment is an enabler, as opposed to a discriminatory environment where you have everything that you look at tells you don't belong here, because then people quit quietly, you know? So it doesn't have to be a stress that's related to post-COVID. It's just the stress of a toxic environment. So business has to make sure that the environment is conducive for people to perform at their optimum, support them. Secondly, within the business itself, managers have to be trained on mental well-being, right? Which we don't do. They have to understand and see the signs that, you know, this person is not performing. Maybe it's burnout, maybe it's the workload. It's important for leaders within an organization, even if they are a line manager of one person, it just makes sense for productivity within the business. You actually have said that I was an occupational health person at some stage, and we didn't emphasize the mental health side of things. I see now that I've been away for more than a decade, actually maybe 3, that they've actually included in the Occupational Health Act a standard in terms of mental health. So you need within the mental, the OT side of things, not occupational, I've been out of medicine for a long time, you can see. But you'll find that most organizations will have a clinic for employees. And in that clinic, it's mainly to check, are we making the people sick? We need to check for this, that, and the other. And during my days, it was never to check for mental health. And that has to be one of the priorities of business. But that's only one side of business. The other side of business is what I call a transdisciplinary multi-sectoral approach to mental challenges or challenges that are faced by the country. I was going to read the statistic, but I thought I'll actually not do that. But when you look at the different surveys that have been conducted, South Africa, like most of the things, we tend to come last or at the worst at. Mental health is one of those, especially over the past 3 years, where I think there's about 25% increase in mental depression and anxiety. And I also looked at a study that was done by the Motsepe Foundation on the BESAs that they support, which are close to 1,000, just looking at the mental health side of things. The incidence of mental depression, the incidence of anxiety, stress, burnout is very high, especially amongst medical students. Why am I saying that in the context of business? Business exists within communities. Business talks about a sustainability report, and we are not going to have sustainable business unless we have people that are healthy, body, mind, and soul. And as business, it's our responsibility to make sure that we do something about it. We might not be specialists at that, but there are other people who are specialists in that. Prof. Ramlal earlier on and I were talking about just how we have pockets of initiatives trying to solve for one problem. We actually need to have those pockets integrated. And one of the things that business is good at is doing just that. If you look at the universities, when you look at the research chairs that focus in an area, mental health in this case, the people that are going to fund it are business. So I believe that business has a major role because mental health challenges are one of the main challenges in this country. Therefore, they have a role that when it comes to even the CSI, it has to include mental health. Right now, I can give you, without even going to the JSE to look at their contribution into the different categories, mental health is just a tickle. It's not where it's supposed to be. So you look at research when it comes to treatment now, the drugs. Research is about money, and business has to contribute. The other thing that I would like to comment on is that when it comes to primary health care in this country, mental health is neglected. If you are from a rural area and or from a township, the clinic that you go to, 9 out of 10 times, I can promise you that the people that you'll encounter there are not trained as far as mental health is concerned. So someone who doesn't have the means has to take maybe 3 taxis before they can come to an institution that provides mental health. Now, I think business are not playing the role, one of the roles that they're supposed to play, which is an advocacy role, which is an activist role to say, government, you will provide the following, because if you don't, we all suffer. So I do feel that as business, we can play a bigger role to say primary health care has to include mental health care. And that involves training the nurses on mental health, but also having someone at each clinic in all the districts who actually understands mental health, so that mental health care is accessible to everyone in the country, not only the ones that can afford with the medical aid in the urban areas. Yeah, it's a long question, but we have a lot of work to do.
Okay, Prof. Ramlal, you wanted to say something?
Yes, if I may, Dr. Dlamini, I just wanted to say that last year the World Health Organization, together with the International Labour Organization, put out a policy brief, a bulletin on mental health at work, which now spells out to employers their responsibility towards acknowledging, promoting mental health in the workplace, preventing diseases, supporting those who actually have problems, and also to reduce the risk factors that are related to the workspace, because we spend about half our lives at work. So it plays a huge role in terms of our overall well-being. But I also want to emphasize that, our health, our mental health in the context of work is a two-way street. That, yes, the employer has his or her responsibilities, but the employee also has a responsibility to seek help. Some of the problems are caused or precipitated or exacerbated by the work environment, but we also take a lot of home-related and society-related problems into the workspace. So once again, it can be a vicious cycle or a virtuous cycle, because if you're going to work and you're not in optimum mental state, productivity is compromised, which means your business does badly. And if the business does badly, your job is on the line. And if you get unemployed, your stress and mental health issues are going to get worsened. So it's really something we have to work collaboratively on for the greater good of not just the individual, but for society as a whole. So I think that's important. And the thing is, I think just because we're talking mental health here, and we have an occupational therapist here right behind me, and I have her back as well because I'm a very multidisciplinary person, that work is therapeutic. I tell people, yes, we all need money. We go to work. We think largely because we need the money. Yes, we need because we have bills to pay. We have to buy food, etc., etc. But an equally important contribution that work plays is towards our mental well-being. And we don't appreciate that until we are unemployed or when we retire. We suddenly find this huge void in our lives, and then we realize all the multiple roles that work plays in contributing towards your overall health and well-being over and above putting money into your bank account. So work, and therefore I'm a great fan of occupational therapists, is us doctors, psychologists, we work on symptomatic relief and treatment, but that's just half the problem, all right? Taking away the symptoms is half the problem solved. We then need to make you functional again, and functional in the two important work spaces, occupationally or academically, and also within society. So definitely, looking at mental health in the workplace is really something that we have to address in this overall promotion of mental health.
Okay.
I just want to add something before you
sure.
ask me a question on the same line of discussion. Also, not to leave out institutions that provide training to mental health professionals. I remember during my first year of psychology, I think we were a group of about 1,500 first years studying psychology. And then maybe a group of about 600, 700 passed, qualified for honors. And at honors level, that's where then the problem starts to happen when it comes to training of psychology. There they take about 20 to 30. Look at this whole a group of students that gets lost along the way, and at masters they take about 12. So access to training as well is still a big problem when it comes to professional training. As a psychologist, I know that restrictions are also made by HPCSA, where they look at the ratio of the existing psychologists within that particular institution and then the student that they can take. But that affects the provision of mental health later on in the workplace and in society in general. If you look at the ratio, of the availability of psychologists and the population that they are serving, then you'd realize the impact of this mismatch when it comes to the training of, the students or professional in higher education.
I think that's a very good point you're touching on. Maybe it'll answer Dr. Judy Dlamini's question on why there's no one at the local clinic in the township area that you're at, because there's such restrictions that we face where it's not because we don't want to have anyone there, but maybe because it's the availability of human resource that is usually a challenge. But I'm glad you touched on that. I think you had a response to Prof. Ramlal's comment.
Not really. Just to add that I always find that we look at restrictions as like they are meant to be. They have to be challenged, you know. So that's, again, part of business, part of the NGO space, where if we need 1,000 psychologists, then government has to open the space up. If it has to be funded, so be it, because those that are in the medical space will know just how many posts in subspecialization or super specializations are being frozen, not because they are not required by the community, but because government decides unilaterally. So I guess when I talk about activism, even within doctors, if you realize that there are 262 districts in the country, with each one having 3 clinics, work the number and push for those psychologists that are required. So I'm actually therefore asking all of us to be activists. Let's not just take what the government is saying and say, well, there are no funds. If we have to put money together, you saw what happened with Solidarity Fund for COVID. All of a sudden, how much was it up to? More than 3 billion rand. That money appeared. So for causes that are not just pandemics, but life, causes that matter, we need to galvanize for the change that we want to see. So that is my plea to everyone, to be an activist for what is right.
Okay, absolutely. So I guess that's a message that goes out to everyone here, everyone in the community, to do that. So I'd also urge our audience to start thinking of questions that we'll ask. I'll give you time later on. Just note your question down. Even those watching live, you can just pop a comment down there. We'll see if we can get to it with time. Dr. Judy Dlamini was just speaking about us being post-pandemic. Mr. Gumede here, you run an online platform for psychological therapy, which is Cloud Therapist. Could you tell us, what are the challenges? It helps with improving access, but what are some of the challenges with me talking to you right now and me joining you, like how our OT is joining us here?
Yeah.
How is it revolutionizing mental health?
Yeah. I thank you for that question, and it's a very, very good question. And I would like to also touch on what HPCSA has actually done to assist professionals in that space. I think it was during the era of COVID where they actually regulated on the issue of teletherapy, where they empowered, psychologists that they can now use, fully use telepsychology to provide mental health support. But of course, there are, positives and the difficulties that we face in the provision of mental health support virtually. But I'd also like to start with the positives because I think it is a great initiative that people are able to access help wherever they are in the world. Actually answers what Dr. Judy was saying, that the issue of ratio, or we have one psychologist that is responsible for 1,000 patients, and there's these 1,000 patients that are actually scattered around the country. So if then you are able to provide mental health support in a digital space, you are then able to cover a number of people from different geographical location in the country. But of course, there are challenges, the issue of connectivity. Since we are living in, era of load shedding, so connectivity is a big problem, and the issue of data, that people need data, so they need to pay for data before they can pay for the actual session. So that becomes really, a really bit of a problem. But also, the issue also around, the connection that you make with the human being digitally and the connection that you make with the human being in person is quite different. I relate better here with my two seniors than with Bev there. Because she's 30. You understand what I mean? Yeah. So those are quite, challenges, but that we have to actually live with. But there are, of course, quite a number of positives that outweighs the challenges.
All right, thank you very much, Mr. Kumed. So practically speaking, we spoke a lot about things that happen in the workplace. So Bhavna, let's assume I am a secretary at this company and I'm suffering from depression. It's been diagnosed by Prof. Ramlal. I've had all the symptoms. And what are the practical steps for me that the occupational therapist takes for me now as a secretary working at this company? What are some of the practical steps that the OT can use to assist me in my workplace?
Okay, thank you for that. That's quite a typical scenario that we see quite often in our daily practices. Usually in a work sphere or that sort of environment, usually it's the employer or the supervisor who will initially identify that, there's something outside of the norm or the ordinary with regard to that secretary. The employer or the supervisor usually has a baseline or an understanding of that person's productivity and the way in which they work. So the moment that person sort of deviates from their normal behaviors, as Prof. Ramlal had explained earlier, that's when the supervisor usually gets a bit suspicious, and then they usually will engage with their occupational health clinic. If that industry or company doesn't have an on-site occupational health clinic or their own general practitioner who consults with their company, they will then, call in that employee and either counsel her, or she's at liberty to go through to her supervisor and say, look, I'm struggling, be it personal or work problems or just life in general, but for whatever the case is, I'm now not able to cope with my demands at work, with my responsibilities at home, and I essentially need help. And that's when the process starts, just asking for that help, or that supervisor who goes to that individual to say, I've noticed that something's not quite right, and, how can we help you? And, it's nice to see that that's happening a lot more in this day and age. And that's when the process starts, either with a referral to a psychologist initially, to speak to someone, to unpack difficulties, to assess and evaluate if that individual has an issue that just needs a little bit of counseling and and can remedy. And then from there, the situation progresses often to the psychiatrist. And as long as work is being impeded, or that person's ability to cope with their responsibilities, not just at work, but with that individual as a mother, as a scholar, as a income provider, you'll then often be referred to the occupational therapist. So, the process then starts for a functional capacity evaluation, where we are looking to assess that individual's functional ability at that point in time. So it's very specific to that time, be it, in a time where you're ill and, you're not able to cope. Your occupational therapist will start with a basic interview process to sort of understand where you're coming from, what are some of the challenges that you as an individual are experiencing or that you've already identified. As Prof. Ramlal says, that person knows themselves better than anybody else does. So it's very useful to, conduct an in-depth interview with your mental health care user to establish a baseline. And then your occupational therapist will obtain collateral information from the employer, usually the supervisor, as well as the human resource department, to establish that individual's current functional productivity at work. So is this individual meeting their targets and their demands at the moment? What are some of the issues identified by the supervisor? Has there been any previous issues of conduct, conflict with other staff members, frequent absenteeism, late coming? So all that information helps me as the occupational therapist sort of understand, is this a pattern that this individual has, or going back a few years, or is this a genuine case where you've got somebody who's been working to their best level of functioning and now suddenly there's something or the other that's preventing them from working to the kind of level that they used to previously. So collateral information from the employer and the supervisor, sometimes from the HR department, is very useful. We then would also require or request for collateral information from the treating specialist. Often it's our colleagues, the psychologists and the psychiatrists. I must say, working with mental health care users is quite tricky. It's almost like working with a paradigm. Every side you turn this object or this scenario, you receive more information, and they don't always correspond. So I think it's very important to gain that collateral information for you to understand exactly what's really going on with the individual. And then lastly, I really, really find speaking to family members as part of this assessment process very helpful. Obviously, family live with the mental health care user, and they are able to provide information that the specialist or the psychologist or myself or the supervisor doesn't often see. For example, is this individual after hours indulging in substances or alcohol? And that's something that, the employer hasn't detected, the mental health care user hasn't disclosed, etc. And then the occupational therapist will come to a part where we do have a battery of standardized tests that are used to assess an individual's visual perception skills, their cognitive ability, to assess their thinking processes. So there are standardized tests and assessments. There are also standardized assessments to assess vocational ability specifically, and those are occupation-specific assessments. So for example, if you are a manual laborer, your assessments and battery of tests that I would use on a manual laborer would be entirely different to the battery of tests and assessments that I would use with this individual who's a secretary or a receptionist and is engaged mainly in sedentary light sort of duty. So it's those standardized tests that we use. And as occupational therapists, we're moving more towards the standardized assessments and tests and vocational assessments, because those assessments are they're standardized. It often gives me a result regardless of how biased I am or whether I like a patient or dislike a patient. It's very, very sort of objective in that way. And the findings from there is very much it's very much valid, and there's very little room for us to sort of guess or be biased in any which way possible. So once you've basically done all of those informal and formal assessments, you've then apply your clinical observations, which I find as a therapist working for 16 years, your clinical observations of an individual and the instincts that you develop and your skills you develop over the years is valuable, extremely valuable. So during this entire process that takes sometimes a day, maybe 2 days, seldomly 3 days, there's a lot that therapist will be observing and will be able to comment. One must also remember that, unfortunately, we do have scenarios where individuals come in saying, we have X, Y, and Z, and then when you assess the individual, the test results give you a totally different picture. So one has to I feel sometimes I'm a detective because I'm trying to suss out, the genuine cases from those that are not false, but not as genuine as some of the other patients we see. Your occupational therapist would then compile a report with all of this information from your interview, your informal assessments, the interview that they've held with your supervisor, then all of your formal assessments and evaluations, and most importantly, the patient, the employer, our colleagues, the psychiatrists, are looking for the recommendations that come out of that report, which will specifically speak to that this individual is currently now either able to return to work to perform in gainful employment as a secretary, or she's not able to, or recommend that she needs an X amount of time away from her work in order to allow her psychotropic treatment to reach its optimal functional levels. She would benefit from ongoing psychotherapy. And from there, we would look at, does this individual need adaptations in her work environment? Is there possibly conflict in the work environment with a colleague that she wasn't comfortable disclosing to a supervisor because people don't want to be victimized? That's when the occupational therapist will recommend certain recommendations, and then very politely recommend to the supervisor, can we make certain adaptations in that work environment? Can we modify that work environment? If she's a single parent who's stressed because of her responsibilities at home, can we modify her working environment? So it looks at physically modifying her ergonomic environment, or it means making adaptations to her current job description. But in whichever way we look at it, it's recommendations that we would look at to facilitate her being able to return to work successfully. And then, ultimately, if an individual's really, really not coping in that current work environment with her current job demands, we'll then have to look at, do I need to place her, recommend that she be placed in an alternate work environment? So as you can see, Dr. Mafuse, it's a long and a lengthy process, and it's looking at that individual holistically and all the different areas of that person's life and responsibilities, and seeing how we can best be able to get them back to work, either in a modified, adapted environment or, in an alternate work environment. But I think as therapists, we're always looking to get individuals back to work. Apart from work being, one's livelihood, it's also very therapeutic, and everybody needs to have that, meaningful purpose in life, that every morning you wake up and you go to work and you do X, Y, and Z. And I feel like once we remove work from an individual's life, that sense of purpose, it's not really there to the extent that it was previously. And in some cases, it actually does more harm than not. So initially, I had seen a trend where a lot of my patients, I'm not sure about other patients, but my patients would come through really wanting medical boarding or early retirement without, going through all of these steps and trying out all of these methods. And, sometimes, it's not really what people think it is, and it's not as great. Now, on the reverse side, I see a lot more of my clients who genuinely would benefit from a medical boarding, or they would qualify, actually saying, please, I don't want to stay at home and I don't want to be medically boarded. I like my job. It's just that I have trouble with X, Y, and Z. And is there any way that, we can help remove those barriers in my work environment? So then there's a lot of contracting with the employers. And, I must say, I've seen that employers are very willing to assist and to help. I think employers are very much so inundated with a lot of claims and queries from staff members. And as much as it pains me to say, but the reality is that, we must use the help that's there and the mechanisms, but we must be responsible and not abuse it. Because, employers are now starting to be a bit dismissive, because they see so many, clients or staff or employees sort of using mental health as a scapegoat. I'm late every day to work. It's because I think I'm depressed, and not rather that I'm late every day to work because I'm not, waking up early in time and getting here. So, if you get the idea. So we're finding that once, staff members do engage in the proper process and they're able to take to their employer a report from their psychologist, a letter from their psychiatrist, a thorough functional capacity evaluation by the occupational therapist, I've not yet encountered a scenario where an employer has outright refused to assist a member. So the process works and it is there. And I think staff members, if they are struggling, it's important to know that you don't have to suffer in silence. Even if your company organization doesn't have their own clinic, you can start your process with a psychologist that you find on your own. You can start the process with your general practitioner, who will eventually help you get to the occupational therapist, who will help you specifically overcome any work-related issues that you have. So I hope I've answered as much as.
Yes, thank you. That was quite extensive. And I think your services are obviously not limited to the workplace environment. It could also be someone who is in a schooling situation, so a child at school, could be even someone who's unemployed also, could be someone who's playing a sport, a return to sport, so it's not just only a return to work program. But I get the concepts are similar. So with Doctors of Minds, we are really much focused on the mental health education of things, trying to make sure that the community is aware of what things to look out for, to educate them, to empower them, to know where to go and what to do. So, Prof. Ramlal, when it comes to education and research, you are a leading expert. You've written in local journals, international journals. What role is there for research and education when it comes to mental health services or providing for mental health?
Thank you, Dr. Mafuze. So I'm going to start with the education part of it because that's my passion as well. I think our biggest challenge as a society is our low literacy in mental health and low literacy about emotions. We tend to focus very much on outward appearances and how we look on the outside and what we're doing on the outside. You just have to look at Instagram posts and Facebook posts, etc. Everything's about the outside appearance. And, my business is about what happens on the inside, which doesn't get enough attention. So I really think that mental health, education, literacy, emotional intelligence, skills need to be included in the curriculum right from preschool. When preschool kids are bullying each other and fighting and calling each other names, etc., we have to teach them how to manage those inner resources, their feelings, their thoughts, those impulses that emerge in them. The earlier we start, the better. And it goes right up, even to old age, because these are things we are not taught in schools. We focus so much on secular education, but we really don't teach people about how to be empowered human beings. So the education should not just be formal, because I do believe that your first school is your home. All right, your first teacher is your parents or your grandparents or whoever your caregiver is. And that's such a neglected and important role that parents have kind of relinquished this responsibility and handed it to teachers. But teachers have a different role. They're teaching you about different things, all right, about how to function in the outside world. So I think we need to also capacitate and empower adults, parents especially, about how, firstly, to look after themselves, all right? And then, because if you can look after yourself and you are literate and you can manage your emotions and monitor your inner world, then only can you look after another human being. So I really feel that we all should have a license before we're allowed to be parents, because it just goes from generation to generation. When I sit and listen to parents, patients telling me their stories, without putting blame on anybody, we can see where did it start. It goes back generations and generations. We mother based on how we were mothered. And my mother mothered the way she was taught. And it goes back and back and back. But now we're living in a modern world where information is easily accessible. You don't even have to go physically to somewhere. Just connect with your phone, you can get information how to pacify a crying child. Anything, ask Google, that's where it's helpful. So we really need education, widespread education in general communities and mental literacy, how to recognize what's happening on the inside, how to modulate that, manage that, and how to cope with it when things start to go rightwards, in distress and illness. But also education of professionals. Whether you're working in the business sector, you're in education, primary education, tertiary education. Educators, as I said, it's not just about educating the intellect, it's about educating the heart and mind and soul. Because they play a role. An unhappy child cannot learn. So you can't say my job is just to teach you about the ABCs and arithmetic. If that child is distressed and you are not recognizing that, that child is going to fail, which is going to further demoralize him or her. And can you see? So we can't separate this and say that's your responsibility, that's your responsibility. It's a societal responsibility. And then last but not least, doctors. It's a neglected area in our training as doctors. And I was saying to Dr. Dlamini earlier that doctors are tasked with looking after the health and well-being of society. But not much has changed since I was a student. There is very little space or time dedicated in the 6-year curriculum to how do I look after myself as a doctor. It's a highly stressful job. And that's why we're seeing these almost epidemic levels of stress, burnout, depression, and anxiety amongst doctors, which is a failure of our system. So yes, widespread education. And I have this dream, so I'm going to share it with you here. Remember the pandemic? Almost every Sunday evening, we all would get around the television, no matter what we were doing, because it was a family meeting. I used to love the memes, of the head of the nation, and it's a family meeting this evening. And we all would go there religiously and listen. How nice it would be, and I'm hinting, I can't nudge you, Dr. Dlamini, amongst all your portfolios there, is that we have a mental health TV channel. Not everybody has a smartphone, not everybody has electricity, etc., but most homes have a television, a free channel where people can hear in their own language, because language is important. A lot of cultures don't have words that we have in the Western dictionary to describe these inner states that influence our mental well-being. So we could have that channel where people could listen, go in and listen to, how do I recognize bullying? How do I cope with it? How do I know I'm depressed, etc., etc. So that's about education. Let me get on to research. Research is necessary because we need to understand what the different conditions are, how they manifest, and how to treat them. Now, I'm going to confine myself. That applies to general medicine. But for mental illnesses and mental health, I've spoken earlier about the fact of how little people actually know about it. So it's not a very attractive area to research in. For a long time, there wasn't much money in it. That is changing. So there is a lot of research happening that helps us to understand the various conditions and what treatments work and don't work. A lot of that research emanated from Europe and America. But we need to understand, as all of us have described there, that mental illness and mental health is a very personalized individual experience that is unique to us based on our identity, race, gender, culture, religion, etc., etc. So there's no one size that fits all. Depression in 10 different people from different parts of the world, different religions, etc., will look different. And for a long time, people didn't recognize that. When I started psychiatry, the general prevailing view was that African patients do not suffer from depression. And the Western textbooks couldn't understand that. And fortunately, we have progressed now because we realize it does exist. But it doesn't manifest in the typical way that you would see it in a citizen of America. Because their inner world is very different from our inner world. Their outer world is different from our outer world. So it's going to manifest differently. So research has helped us to unpack those things. So it's really necessary. And also the treatments. So also treatments, we're following very much a Western paradigm. We need to have Afrocentric theory. We need to have Afrocentric models of treatment that speaks to our people that they can relate to. They don't understand this concept of taking a tablet and suddenly I'm going to feel happy even though my whole crop has been wiped out by the flood. That's a framework and a worldview that they don't share because the Western mindset is very different from Asian and African, because we are collectivist nations. The Western group is very individualistic, it's all about me. So our approach has to be different. Psychotherapy was born in Europe and America. Those models don't apply to, you can't go and speak to a stranger about intimate problems in your married life, in African or Eastern culture, but in the Western culture you would. So can you see, that's where research is important for us to understand local context, local needs, so that we can come up with locally relevant solutions that are also pragmatic. We don't have the amount of resources that other first world countries have. But having said that, and I know we spoke about resources earlier, let us not think that we need more money necessarily. It's about how we use the money. If we follow the Western trajectory, yes, we need more therapists, and they'll give you statistics and more medication, etc., etc. Mental illness has existed since the time mankind set foot on this planet. Because you'll find references to it in literature, in the Bible, in religious texts. So it's always been there, the melancholy, etc., etc. And people had inbuilt mechanisms within their society groups, their communities, within their religious and cultural groups, in terms of how to deal with that. We had support. All right, you knew who to go to, the elder or to the traditional healer, and they knew how to diagnose you and to provide solace. It was a community endeavor to support you. But with Westernization, that sense of community, that sense of Ubuntu has fallen away. We have become so individualized, isolated, by following a Western paradigm that doesn't speak to the heart of who we are. So we really need research to come up with locally relevant models of treatment. We've seen beautiful examples of it in Zimbabwe. The friendship bench model by a psychiatrist whose name eludes me right now. But because of a lack of resources, and I've been long enough in education to know that as much as we want to churn out more graduates, that doesn't necessarily translate into more service on the ground, because graduates also have their own plans about what they want to do. So the friendship bench model essentially was to train gogos in the community, the elders. They set up a physical bench in the heart of communities, so patients don't have to take 3 taxis using money they don't have to come and seek a doctor or a therapist. And so these gogos got basic training in psychological first aid, recognizing problems, providing support. All you need is an open heart to deal with most of the mental health issues. Yes, when it's mental illness, then you you need a specialist, or you can train somebody else to render the service. But it's a highly effective model. So please read up about the friendship bench model and how effective these gogos are in terms of reaching out and accessing and supporting people in the community. So research, coming back to that, I'm not a big fan of publishing for name and fame in fancy journals, etc., for the sake of research. We need research to be able to speak to issues on the ground that will deliver change in real time. We can't wait to identify the gene for X disorder, which will take decades of research, and it's still not the solution, because the treatment, as you've heard from my colleagues, is not about popping a pill and it's going to cure all of life's problems. It's a holistic approach. So that is the kind of research we need. And I think our continent has a lot of resources that are untapped. The shift now in mental health is the concept of task shifting and task sharing. We will never have sufficient numbers of mental health professionals, no matter how much of money we have. All right? But if we capacitate people to deliver mental health support, to prevent mental illnesses, and also in the aftermath of mental illness, because part of the rehabilitation, people live with mental illness, so they need support. A lot of the need will be removed from healthcare professionals who can then focus on treating the severe common mental disorders. So yes, all of the people listening out there, a lot of research to be done, but let's make it Afrocentric. Let it be relevant to our people so that we can make a difference.
Thank you. You're just reminding me. You're just reminding me of a concept that I used to live by: to think globally but act locally. So I think that could be something that we could all take in when it comes to this. And I think we could chat the whole night, but I feel like we don't have enough time. So I'll just ask one last few questions to the panelists, one each, and then just some closing remarks before we get some questions from our audience. Prof. Ramlal spoke about investments. Dr. Judy Dlamini, you are in the business field. There was a study done, I think it was around in the Western Cape. It's a costing study on mental health. So with the results of that study, they say our health budget, at least 10% of it needs to be used for us to have a sufficient functioning mental health program or projects that's going on. So currently, South Africa, we are only using about 5% of it. These are statistics from like 2017. So in terms of return on investment, how do you think business can assist or help in terms of looking at mental health service delivery from a business perspective? Because obviously, us throwing in money there is not the solution, but like, how can we navigate that?
You raise an important point, because the 5% you talk about instead of 10, it's not business, but it's government. So it goes back to what I was saying, that we all need to be conscious of what is required by society. And whether it's business, whether it's churches, whether it's traditional leaders, as a collective, we need to say, are we serving the population optimally? And Prof. Ramlal was talking about, it's not only about throwing money at it, it's also about effective use of that money. If you just look at what, again, Prof. Ramlal was talking about in terms of training society, I was reading somewhere, Prof. Ramlal, I wasn't aware of the friendship bench, but they were talking about Zimbabwe, which we actually, when you look at Zimbabwe, you think of all the negative things. But they were saying they are quite big on including mental health within primary health care. So it's not about money. It's about using the resources that you have effectively and seeing each member of the community as a resource that can be used effectively. So I think for me, it's bigger than just how much is being spent and also what role business can play. But coming back again to the research, because research is money, whether your research is to look at empowering the communities, whether it is about going back to our indigenous ways of doing things, which is very important, you need money. So that is where, when I talk about the multi-sectorial engagement, I'm talking about the tertiary institutions working with business and government to say what is it? We are a sick nation. It doesn't matter what statistic you look at. If you look at violence, we are one of the most violent nations in the world, the top 3. And there is a reason for that. You know, apartheid was legislated violence. Have we dealt with it? You know? So I think there is just a lot that we haven't dealt with as a society. And I do believe that all the different sectors of this sick society have a role to play collectively. And we do it sometimes when it suits us, but we don't look at the fundamental basic needs of the community. When you look at the unemployment, it's all these things that impact on mental health. And it's the young people, the 15 to 32, that are unemployed, 52% of them. They're not working, they're not in a job, they're just loitering around. Then you have substance abuse, which is within the mental health sphere. So I really feel that as society, we need to have a more collaborative and integrated approach to the challenges that we have. And therein lies the answer. And I do think we need to think locally. And the solutions that we have for local challenges can then be used all over the world. There are so many examples of that. And because we have self-hate as Africans, we always look outside because outside is better. We don't love ourselves because we haven't dealt with the colonized mind. So there are just so many things, Dr. Mafuze and colleagues, that I think we need to have serious conversations, and mental health is part of that. Just having serious conversations about who we are, where we are, and how can we get out of the mess that we find ourselves in. Why are we a sick nation? And what will it take for us to be healed? So I think it's a much deeper question than just, a few conversations here and there. And yes, a channel on mental health. And even just a program on radio, because it's funny how so many of our people rely on radio, and then television is that step higher. So I do feel we have a task at hand collectively. There are many pockets of initiatives that are there. How do we try and get people under the same umbrella of making us a healthy nation? I always envy those Nordic countries mainly because they tend to be high up there when it comes to happiness. How do we get there, We talk about Ubuntu. Really? Yeah. Anyway, thanks.
All right, thank you very much, Dr. Dlamini. Perhaps, Mr. Kumete, in closing from your side, there are people already attending therapy. However, there's a high dropout rate in therapy. Even with persons who commit suicide, we hear that perhaps a week prior or sometime they had seen a mental health care practitioner. Perhaps what are some of the challenges that people face when in therapy, so that you know that, okay, if I'm having this difficulty, then I shouldn't give up, What are some of the challenges that people face when they undergo therapy from your experience?
No, thank you so much. But I think Prof. Ramla has already actually answered that when she was talking about, the provision of mental health that is context-friendly, that is Afrocentric, that understand people from where they are and where they come from and where they are situated. My PhD study, I'm looking to create a model of leadership informed by Ubuntu, because I believe in the workplace there is a lot of mental health difficulties. There's a lot of squabbles because the leaders and the people that they are leading, there's no alignment. So we say we are a nation that is living by Ubuntu and those values, but when you go to the workplace, we apply Eurocentric models. So there's that conflict. So it's the same in therapy. We are trained in therapy using Eurocentric model, cognitive behavioral therapy, person-centered therapy. All those are models that have been adopted from America, like Prof was saying. So it is our responsibility as young mushrooming psychologists to study and introduce models that takes our people into consideration, that takes their feelings, their upbringing, their culture, into consideration if we are to positively affect them, So I think that's one of the big challenges that we are still struggling with. Like Dr. Judy was also saying that, the issue of colonization actually carried across, even in education. The models that are there are still very Eurocentric. So, yeah, so I think that is me answering from an academic point of view, but also from the accessibility of therapy. I think there we also need to create platforms like the digital space. That's why I'm excited to be in this platform, because it creates that education, that dissemination of information where people can easily have access to information about mental health, because also people come to therapy expecting something different, and when they get there and it doesn't meet the mental picture that they had already when they were coming there, because they think that the therapist is coming to give them a pill, and then voila, their problems are all gone. So when the psychologists start asking you questions and they want you to open up, and some of them they're not ready to talk about those and open up, and then it becomes a dead end, and then they fell off. Yeah, so those are one of the problems I can highlight. Yeah, thanks.
Okay, thank you very much, Mr. Gumede. Since Prof. Ramlal, you brought up the issue of this Afrocentric, trying to make sure that it's individualized into our context. Where do you see mental health heading? I mean, in our setting, in South Africa, we've got people from different cultural beliefs. In terms of access-wise, am I only going to a hospital? Where else can one seek refuge if suffering from a mental health problem?
I think we will always be cognizant of the resource constraints that we have, both in the broader health sector and also in mental health sector. I think as a country, we call ourselves a rainbow nation, and at the end of a rainbow is always a pot of gold. And I think every one of the many cultural groups within our country has a rich heritage of resources, of coping mechanisms, of support that is inbuilt that we need to reawaken. We've abandoned this in our pursuit of this Western model of life and in the colonization process. We need to look back, I can't remember the story now, but we go looking outside for things that are already within ourselves, all the treasures. So we need to have an open mind, in terms of how we approach the mental health challenges in our country. And some of my thoughts are where we can look at, apart from the things I've mentioned earlier, is that first and foremost, don't depend on external sources for all your needs. You really have to empower, or I use the word empower yourself. First and foremost, there is no substitute for that, all right? Therapy, a lot of people leave because they want that quick fix. The Western model is you take a pill, you'll get better tomorrow. Unfortunately, life is a lot more beautiful and complex than that. It requires inner work. If you want to change the programming that you've inherited over generations, it requires work. But I promise you, it may be hard work, but the rewards are amazing. It's really worth the effort. So firstly, in terms of learning how to care for yourself and take responsibility for your health, because nobody else can take responsibility for your well-being unless you are committed to that process. Secondly, it doesn't mean that you exist as an island. We are social beings, our brains are social organs, which means that we thrive on connection. We need to be connected to people. So this Western isolated life is not good for our brains, not good for our health. Connect again, all right, with our extended families, our communities. If you go back in our history, there's stories of who was your family. It was the whole community. You couldn't say this person is, but now it's just your blood relative, it's your siblings and whatever. So we need to have that mind shift in terms of reaching out and connecting with each other socially, emotionally, because that's what gives us resilience, gives us the support, the informal support, which is as important as formal support. Because if you have the informal support, it's more likely that you're going to get the formal support later on. So the third avenue that we can look at is, yes, the government, but I want to be positivist tonight and not say anything further there. But if you're going to rely completely on the government, you're going to be disappointed, all right? So I think in partnership with governments are non-governmental organizations. They have done fantastic work. they do it with less resources. In my own experience, and I've worked with several NGOs, they're far more efficient with their resources and frugal, perhaps because it's harder for them to get money. But the reason I like their approach is because they're in the heart of communities. And that's where you need proximity, all right? The thought of, I'm depressed now, and then I've got to get up at 4 o'clock and take 3 taxis and get there, wait in a queue, etc. It's not. But if there's somebody that's in your community, you just go to the local church or wherever, and you're going to get somebody who's going to talk to you. So we really do need those kinds of informal resources, and obviously our TV channel. But what I'm saying is, let's be creative. All right, let's be creative, let's be resourceful. I think South Africa has led the way in huge struggles in the past. We have what it takes, all right? And so don't look at that Western model that you need to have so many psychologists for that. We can do task shifting, task sharing, we can capacitate people, and we can make more effective use of our existing resources. If we get more, that's good. But if we're going to sit and lament what we don't have, it's not going to help us, not going to help our mental health, all right? So we have enough brilliant minds in the country to be able to come up with innovative ways of dealing with that. And that's where I see the future of mental health, where mental health is everybody's business. It's not just the business sector's business. It affects everybody, the school teacher, the parent, workers across all spheres, people in leadership. Find me one person where mental health does not impact on their health and their livelihood. All right, so we have to all take collective responsibility for becoming more mental health literate and for investing in our mental health. Okay, because as the World Health Organization says, there can be no health without mental health. Physical health, bodily health, mental health goes hand in hand together.
Okay, thank you so much for those remarks. And then perhaps, Bhavna, from your side, last comments. How can there's a variety of mental health disorders that can affect an individual, but when do we regard it as disabling from an OT perspective? When are mental health disorders disabling or causing significant impairment?
I think the best and the simplest way I could describe this one is, for any individual, is that if you are diagnosed with an illness and you may be taking treatment, the treatments may be working or partially working for you, but the moment you're not able to cope with your functioning in your daily life, so not just work. Remember, when an occupational therapist speaks about work, work is not just the work we do when we go to work and get paid a salary. So we are looking at all of your activities of daily living, be it a mother, a homemaker, an income provider, a scholar. So the moment you're now not able to fulfill these roles to the best of your ability in a way that you used to be able to perform it, that's when alarm bells need to start going off. And that's when you now need to start considering that something or the other is going on. If you're not already diagnosed with an illness, that's when you need to start wondering, is there something that's medically wrong with me? Is there something now that's, psychologically impeding me? So you need to basically, the best marker that you can use is to know that when I can now not function in the best way that I was able to. So not the way your friend, your cousin, your relative is functioning, but you and you know how you would function, the way you would function, your level of functioning. So the moment you're not able to do any of those things the way you used to do it, that's when I would say you need to be worried and concerned. And, like Prof. Ramlal explained a little earlier, is that it's only human and normal that we all have our ups and downs. We have our good days, we have our bad days, and there will be, days where we're not able to cope. And I think most of us in this day and age can identify with that. But if you are now struggling to cope in your daily activities, for a prolonged period of time, longer than usual. And for lack of a better word, if you're not able to snap out of it, I think those would be the warning signs that you need to. They're subtle signs, but they're very effective in telling you that something somewhere is not right. And that's when you need to make the first step. And try, I'd like to say, avoid Google as much as you can, and try not to diagnose yourself. If you know something's not right, you need to seek the proper professional help to try and understand what exactly is going on, be it medical, just some supportive counseling, or, some adaptations at work if work is an issue. And then you can plan for there. So ultimately, whatever barriers are impeding your functional performance and your ability, if we can identify, then we can rectify and rehabilitate those. So those barriers are removed, and then you're basically at liberty to achieve to your optimal level. And I think that's what we all want, essentially, when we speak of a common goal. We want to see people being able to thrive in all spheres of their lives and to be able to achieve to their maximal best. And I think that's as much as we can ask for.
Okay. I think one last comment from Prof. Ramwal, quickly.
Sorry, I'm aware of time, but I think I'll be remiss in not mentioning that we really need to advocate for mental health. Advocacy. So I always say that, if you look at what the Treatment Action Campaign did for HIV, there's an example of the power of the people. So we haven't addressed specifically those affected by mental illness. We all are affected. If you may be the index patient, but everybody, your co-workers, your family, your friends, everybody's affected by the illness. So you're not alone. But I want to share, I think that's something we need to all do, whatever levels we are, to advocate for mental health. But I also want to share something that's a proudly South African-driven initiative. It's called the Global Peer Mental Health Network. And you can Google it. It's founded by a South African woman, Charlene Sunkel, who she's a person with lived experience. And it's a global organization to provide a platform for advocacy and to give a voice to a very stigmatized and marginalized clinical population. And often mental illness takes away that very voice that you need to advocate for your needs. So we as a society need to be the voice for those individuals at times when they cannot speak. So if I say nothing else today, it's about please join us at whatever level you are to advocate for mental health.
Okay, thank you very much. So certainly if we can identify, we can rectify. So I think that's why Doctors of Minds is here. We've identified some of the shortcomings that are there within the mental health care space, and now we want to rectify with such platforms, with collaborations, working with different sectors and different groups. So without wasting any further time, I'll just take one or two questions for our panelists before we close. I think we have one question there at the back. Quick one.
Afternoon, everybody. I am so happy to be part of this conversation. I wasn't invited. I was here to do my work, and then I saw like, oh, God. So I think this is a very important conversation because, to quote from Plato, you cannot heal the mind, you cannot heal the body without healing the mind. And our society is not exposed to therapy, to counseling. So I think it would be very good to also implement counseling and therapy from a young age. In school, let us have therapists at school, let us have therapists at church so that you are exposed to talking to someone. Because now, let us not treat mental health when we're at an unbalanced mental state as well. So I think it's Doctors of Minds, health education. Health education is very important. I would also love to be a mental health advocate as well, because I think even Prof quoted to say it goes with awareness. You have to be aware of yourself so that when there are any alterations, you are aware of, okay, now something is off balance. So yeah, I'm so happy to be part of this conversation. I think as a young person, as a young mother who's studying, who's working, definitely I'm gonna have days where I'm unbalanced and I need to come back to myself, but I cannot come back to myself when I do not understand myself. So I think let us have therapists, let us have counselors at school, in tertiary. Yes, we do have them in tertiary, but not everyone is exposed to, as to say, we have a therapist that's on campus, but I've never been to one. So I think it's very important because some of these mental states that we get to, we cause them to each other. There's a breakup that happens. I go in a mental breakdown. Academically, it's not working. So I lose that feeling of self-importance. So I think, everyone needs to feel important and everyone needs to know that they have a place or a role to play in this world. And also, just to cut the story long short, I think with the state of the world and the state of the country as well, that could also cause some mental anxiety and some mental disbalance. So we do need each other and we all do need therapy at some point. So if we get therapy at a young age, being exposed to know there is therapy, you can talk to someone, there is someone to talk to. I think as we grow up, as children grow up, because when you go to therapy, you would find that, yes, even Prof also said that it goes back to spiritual alignment. It goes way back. So having that at church, at school, families, I think, we're heading the right direction. And thank you so much.
Thank you very much for that comment. I think it resounds a lot. I think there's just one comment or response from Prof. Ramlal, and then we'll take a question from Mr. Memela.
A very brief comment, but that's the hazard of when you're passionate about mental health. So 2 very brief comments. Firstly, asking for help and seeking help is a sign of strength. All right? It's not a sign of weakness. And secondly, going for therapy does not equate to you being mentally ill, crazy, insane, etc. Therapy is about growing, learning to understand yourself better and growing to become a more efficient, effective, happy, content, peaceful person. So let us not equate therapy with a stigma that, oh, she's going into that door, there must be something wrong with her. All right, therapy, you want to learn, you want to grow, you want to thrive, therapy is good.
Okay, yeah, you can go ahead, Mr. Memela.
Okay, I won't be long. Just last year or so, the World Health Organization launched, what is it called? Self-Care Month, which is from the 24th of June to the 24th of July. And I ran a campaign associated with it. So I think it ties in quite well with the issue of mental health. And even now, Marianne launched this thing of Self-Love Month, which is now in the month of June. So I think it's to support everything that's been said and done in this particular session, the idea of creating and consistently reaffirming that tive of mental wellness. It's so important. And another one is men's mental health. It's very neglected. I've been in sessions where I've had to speak on behalf of young men regarding their mental health issues. They are vast, they are depressive. When you listen to them, a lot of people have considered suicide. So I think we really need to punt this out. It's more of a comment what I'm saying. Is an issue of constantly and consistently raising that awareness, and in this case, men's health awareness, because I think men don't speak, and then suicide is the answer, which is it shouldn't be. I'm done.
Okay, thank you very much, Mr. Memela, for that. I think there was one last comment there.
Thank you very much for this initiative. Opportunities don't just happen, you create them. And I think this platform is talking to that. It wouldn't have come at a better time. So my key takeaways, I came in a little bit late, just listening to the discussion and the experts on the various areas. There's one pillar that is coming out for me, the framework. I hear an integrated approach, holistic approach, not one over the other, but an approach that creates a balance and harmonizes the biopsychosocial, cultural, spiritual type of model. And I think that for me is important because each and every area is important. As human beings, we have different dimensions, and all of those dimensions are important. Takeaway number 2 is the multidisciplinary approach. I think hearing what Prof. Ramlo alluded to in terms of being Afrocentric in our approach, I'm reminded of the work of Prof. Mkize at UKZN in Peter Marisbeck with the Art Institute. And thinking about that, there's an opportunity of collaboration there because there's a lot of work that's been done. He's also introducing a course in psychology that looks into African ways when it comes to psychosocial intervention, psychosocial therapeutics. The third pillar for me is that of education, which is important, education, workshops, and empowering. And taking what Prof. Ramlal again said in terms of the mental health spectrum, you want to intervene at a stage where you want to reduce the risk before major damage has been done. And there's an opportunity there when it comes to education. Also, as a psychology practitioner, there are so many ways that we can use. One of the things that I've found useful when it comes to education is the issue of language, because as practitioners, we don't have the language. Like, I'm into positive psychology, and with the area of resilience, I actually battled to define what is resilience in Zulu. If we're going to be really talking to Ubuntu concepts, that we already know about, language then becomes an important area in these new concepts that we are coming up with. And as practitioners at an individual, research takes time, and we do need research, but we can influence in our different ways. One of the things that I've done is to even go to scholars, African scholars, to say, what is resilience? And there's actually no word that clearly defines. They will say uqina, but no, it's not uqina. Ukumelana nomzima, but no, it's not ukumelana nomzima. And the scholar said, use izaka. When you are teaching there, use examples that people can understand. Go to Inqolobane and use izaka. There's a lot of wisdom that you get there. And the concept like resilience, you can clearly define it from an African point of view and say, everybody understands that in Zulu, that when you're going through adversity, you need to have that foresight. Do not throw away, the baby sack just because you are facing an unfortunate event of losing a baby. Because the foresight for the African, from the African point of view, you're still going to have another baby and you're going to need that baby sack. It's long, but that's how you can explain it. So what I'm saying is that in these 3 pillars that I'm saying, when it comes to education and we want to talk to the local, we also have an influence as practitioners using the examples, whether you're doing a workshop, but making sure that there is an example, there is local, that people can understand from, your intervention. Thanks. Yeah.
All right. Thank you very much. You see, when with psychology or mental health, there's still so much more that we want to share or talk about. But so I won't deny you the opportunity. I mean, it's still the launch, but I'm going to be very strict when it comes to the upcoming episodes on these. So I'll just allow Mr. Gumede and Dr. Dlamini just to respond to those comments, not to restrict anyone. I think everyone is ready for supper or something.
No, thank you so much for that comment. I think it's a profound comment, and I really identify with it. Actually, yesterday I was contributing on UKZN FM on a show. It's called Injobo Itungele Bandla. You know, so I was just complimenting just the naming of the show, because they are focusing on the man, you know, in our society, so that men can open up. And you'll be so surprised that men usually don't open up, but on a number of calls that we, you know, actually received on that call, just on the naming, you know, of the show. You know, so things like, you know, it really says something to an African man, because you just have undressed him. Once you say that, you know, don't die on your own. It's a wisdom from Obabomkulu. In an ancient days, they knew that there are problems that are actually, you know, you would not be able to solve on your own. But as a community, you know, as you know, because we are relational beings, if you then talk about your problems, then it becomes a bit better. So if you apply that, you know, in therapy, it becomes easy and healing happens instantly like that. But I just want to add something as well. From the organization that I'm from, Cloud Therapist, Prof, you said we must be advocates for mental health. So there are actions, practical actions that we are currently doing to actually increase access to mental health. We are currently supporting the junior doctors and doctors that are still doing their community service, that are doing their internship, to provide free mental access for them in a maximum of about 3 sessions. So that is available. We have partnered with Sama. Yes, Sama. We've partnered with Sama to provide such an initiative. So you can also spread the word that doctors that are struggling, yes, we are able to provide them free therapy and stuff like that. But thank you so much for such a comment. It really is a great one. Thank you.
Just very briefly, I want to thank Jabulo Stole. Jabulo is a psychologist, also a UKZN alumnus, and she runs a resilience workshops for companies. And I think you raised very important points, Jabulo. There was a guy, may his soul rest in peace, uThokozani Mandla Nkosi Nene. He was a linguist. And one of the challenges that we have in the country is not building our languages into academic languages. And that is a serious problem. When HIV and AIDS came, he's the guy who named it Ingculazi. So the multidisciplinary approach you're talking about talks to that, because languages are developed. You actually develop them so that you can use them in your practice. So that's a challenge to those that are in language. The approach has to be multidisciplinary. But I know Dr. Mafuze is looking at me and saying, you know what, you're standing between us and a snake. I just want to thank everyone who's here, but more importantly, I want to thank Dr. Mafuze. You know, they say people who are young, you need this intergenerational collaboration. I've never seen someone who runs like you do. You speak casually, and then there's a logo, there's this, there's that. You are a trailblazer, and I really want to implore everyone to support you, because you are driving this, and I know you are going to do so well in changing the way mental health is perceived, in removing the stigma, and making us a better nation. I really just want to thank you, because your leadership is second to none. I appreciate it. Thank you.
Thank you very much. Just for the interest of time, so Doctors of Minds, we are going into the television space. We will be going into the radio space and various other media platforms, because we understand that the channels for delivery of messages is going to be different for a variety of persons out there. There will be outreach projects or programs. So this is just our official launch and first episode. Our subsequent episodes are going to be more focused on lived experiences together with mental health care practitioner specialists who will be part of those episodes. So we will try and have regular episodes that are going to be coming out. So I'd urge everyone out there to follow us on social media at Doctors of Minds. We will be releasing statements, especially this month with Mental Health Awareness Month. But I think from our side, we'd really like to say thank you to all our panelists, Bhavna joining us in spite of the challenges that she faced, but she was willing to be part of us, and thanks to technology, making that very much possible for us. Professor Ramlal, such a busy psychiatrist, head of psychiatry in the country in terms of the colleges of medicine, training and ensuring that we have a young generation of mental health care practitioners who will be responsive to the needs or signs of the times, and not necessarily just regurgitating what the text tells us, which was research from 15 years back, but the times now may be different. Cloud therapist, Mr. Kumete, we thank you so much for your support. Definitely going to be working together in very much more of our projects. And Dr. Dlamini, being the initial sponsor of this episode as part of Sfiso Publishers and Equal But Different, we are looking at collaborating with other institute, corporates, and other various organizations for us to make sure that we continue with our goal in terms of debunking and making mental health easy. I like to say making mental health fashionable, such that we can be able to relate with it. It should not be something that is foreign. It must be something that is easy to talk about. So in all of that, I just want to say thank you to everyone, to our viewers out there. Do catch us on our next episode. We will announce who's going to be there. We do have a very special guest who's going to be joining us, and it's someone that you may have heard of, but we will be looking out for that. So thank you to everyone, and thank you to our panelists at home. Yeah, so thank you. Good night. Free to enjoy.